You have faced many challenges in life, and I have seen you fight and come out on top. This cancer is no different. You are a fighter, and I know you will come out on top as always. Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. These contrast with benign tumors which do not spread. Possible signs and symptoms include a lump, abnormal bleeding, prolonged cough, unexplained weight loss, and a change in bowel movements. While these symptoms may indicate cancer, they can also have other causes. Over 100 types of cancers affects humans. Tobacco use is the cause of about 22% of cancer deaths. Another 10% are due to obesity, poor diet, lack of physical activities, or excessive drinking of alcohol. Other factors include certain infections, exposure to ionizing radiation, and environmental pollutants. In the developing world, 15% of cancers are due to infections. Approximately 5 to 10% of cancers are due to inherited genetic defects from a person's parents. The chance of survival depends on the type of cancer and extent of disease at the start of treatment. In children under 15 at diagnosis, the 5-year survival rate in the developed world is on average 80%. For cancer in the United States, the average 5-year survival rate is 66%. In 2015, about 90.5 million people had cancer. As of 2019, about 18 million new cases occur annually. It caused about 8.8 million deaths. That is 15.7% of the total deaths. The nationwide lockdown introduced to prevent the spread of the coronavirus has also had an impact on cancer care. When the lockdown was announced on March 24, many patients were unable to go home after cancer treatment, while those scheduled for chemotherapy or surgery found it difficult to travel to Mumbai, Delhi, Chennai, and Bangalore, where large cancer hospitals are situated, as all modes of transportation were suspended. More than 1 million new cases of cancers are reported in India every year. Because most government-run facilities are in big cities, people from rural areas often have to travel long distances for treatment and follow-ups. At the beginning of the lockdown, the Ministry of Health directed state governments to keep running non-COVID-19 related essential health services, including cancer treatment and screening. However, few patients could access these services with no means of transport. Delayed or postponed surgeries might result in tumors being upstaged and reaching the operation table at a later stage than they would have ordinarily. The delays might also move a lot of patients from the curative to palliative stage. Both these scenarios may adversely affect long-term survival and possibly lead to worse outcomes. And today, to discuss the COVID-19 impact on cancer patients, we have a very, very elite, learned experts on our panel. I am sure all our viewers globally will be benefited by hearing their views. I would like to invite my first guest. He is Padam Bhushan Professor Dr. Suresh H. Advani, MD, FICP, FNAMS. Dr. Advani is the Director of Medical Oncology, Jaslok Hospital and Research Center, Mumbai. He is Fellow of National Academy of Medical Sciences, FNAMS, Member National Academy of Medical Sciences, MNAMS, Fellow Indian College of Physicians, FICP. He has done his MD, General Medicine from Bombay University in 1973. Before joining Jaslok Hospital, Dr. Advani was the Professor and Chief Department of Medical Oncology, Tata Memorial Hospital, Mumbai from 1985 to 2002. Dr. Advani was awarded Fellowship of International Cancer Research Technology Transfer ICRETT by the International Union Against Cancer in 1981. He was also awarded Fellowship of Yamagiwa Yashida Memorial International Cancer Study Grant of the International Union Against Cancer UICC in 1986. He received several national and international awards. The list is so long. If I will start reading, it will take the whole my program. But yes, there are few which I definitely want to include. That is Najil Gad Il Mavla Award in 2005, Lifetime Achievement in Oncology in 2005 by Harvard Medical International, Gifted Teachers Award 2004 by the Association of Physicians of India, Dhanvantri Award in 2002, Padam Shri by Government of India in 2002, most prestigious Dr. B.C. Roy National Award in 2005, Padam Bhushan in 2012, Limca Book of Records, Pupil of the Year 2016. He holds many prestigious posts, including President, Indian Society of Oncology, 1999 to 2000, President, Medical and Pediatric Oncology Society from 91 to 94, Editor, Indian Journal of Hematology and Blood Transfusion since 1993, President, Indian Society of Medical and Pediatric Oncology from 1991 to 1995, recognized teacher for DM in Medical Oncology of University of Bombay, examiner for DM Medical Oncology of Madras, Bangalore and Gujarat University, honorary editor, Asian Cancer, published by Excerpta Medica, Hong Kong. He published 653 research papers in national and international journals of repute. Recently, he has embarked upon the project of writing syllabus along with teaching manual for DM Medical Oncology course in association with Indian Medical and Pediatric Oncology Association, and etc., etc., etc. So long, I have not seen. I have done almost 250 shows in last 6 months. I have not seen such type of biodata of any of my guests. Thank you very much, Dr. Advani, for joining our show, because it's a pleasure and very much privileged to have you on our show. So, Dr. Advani, as you know, the COVID-19 engulfed the entire world. And today we are in a very, very typical position. Although we are doing unlock, we are in unlock 4, but still the number of cases are rising. But we would like to know from you, COVID-19 impact on cancer patients. Dr. S.H. Advani, please.
Yeah, good morning. Good morning, Mr. Goel. And I really appreciate your effort to get all of us experts together to discuss the impact of COVID-19 in the management and prevention of cancer. As you know, COVID-19 has changed our life. It has really, even today, we feel that the era before COVID-19 was absolutely very efficacious and very interesting. And COVID-19, with all the limitations which we have to follow as per the WHO guidelines of staying at home, safe distancing, putting the mask, and avoid handshaking. All these things have created a big problem, particularly in the field of oncology. The first thing which I want to mention is, as soon as the COVID-19 was announced that this is a pandemic, most of the medical professionals went into a hibernation. This is what happened. That was an immediate reaction. Everybody started not going out. Some, of course, remained there to serve in the hospitals and all, but also patients decreased, the doctors decreased, all professionals really went into the staying at home. And over a period of time, within a month or so, everybody realized that this is not a disease which is going to go away in 4 weeks or 6 weeks. That is what everybody was expecting initially. And therefore, everybody tried to gear up. The first thing which, as a cancer patient, everybody noticed was that the cancer patients were absolutely became afraid of coming to the hospital, coming to the doctors. The reason is very simple. Everywhere it was mentioned that cancer patient carries an extra mortality if they get the COVID-19. And that created a tremendous fear in the patients suffering from cancer. And that's where the cancer patients' attendance in the hospital went down. Of course, the attendance also went down because of lack of transport facilities. No taxi, no rickshaw, no car, no train, no plane. So it really went down to a tremendous extent. And after some time, today we have realized and we go on discussing that how we will manage our cancer patients in the COVID-19 era. I think it's very clear all over the world today that we don't have to change our basic concept of treating the patient. We cannot change. We cannot give inferior treatment to our patients just because there's a COVID-19 pandemic. We have to give the best of the treatment because any disease, whoever is suffering, for him, that's a major disease and he has to receive the best of the treatment. So, all of us now, over a period of time, slowly, we are realizing that we must do the best of the treatment for our patient. And that's very important factor. And today, I can assure you that today all patients who are coming, they are receiving a full treatment, no compromise, just because there is a COVID-19. Of course, patients, relatives, we, everybody, healthcare providers, they are taking care. And that's a very good thing that has happened. So once we have realized that we have to give the same amount of treatment, the problem came up in terms of availability of the human resource, in terms of availability of infrastructure, in terms of availability of the space, because all these things were occupied by the COVID-19. So COVID-19 ICU was full of COVID-19. Everything. Nurses were busy in treating the COVID-19 patient. So the nurses which we were they were serving the bone marrow transplant patient. They went to serve the COVID-19. This is what really happened, and therefore we thought that we are now limited in terms of the applying the treatment. But I think slowly again the government realized that we have to do something. So they sort of gave the instruction that no, COVID-19 has to be looked after because it's pandemic. But at the same time, non-COVID diseases have also to be treated properly. So I think once those instructions came up, everybody became very much alert and started gearing up. And today, all the hospitals are geared up to treat both COVID-19 and non-COVID-19 patients. So I think that's the positive thing that has happened. And today, in majority of the hospitals, particularly in the cities, they are receiving the best of the treatment. But still, there are a few factors because we are not able to treat everybody. The space is limited, and nursing staff is still deficient. Infrastructure is still limited. But even in those limitations, we are able to deliver the best of the treatment. But I think one thing more that I would like to mention here that we have learned how to treat the patients even in the presence of the some of these virus infections. And we have also realized that the treating such patients in the COVID-19 era the results are more or less same. So I think that's a very important observation. One of my colleague has already uh, printed the paper in which they treated more than 400 surgeries which were carried out, and everything went on as per usual. Similarly, the medical chemotherapy was given to a large number of patients, and we have shown that the results are same. Some of these patients did develop the COVID-19, but luckily all those patients have also recovered. So you can understand that slowly all of us, all my colleagues, I am sure everybody will express their experience, that we have become confident that we will be able to overcome the hindrance to our treatment for the cancer patient because of the COVID 19. Thank you very much.
Thank you, Dr. Advani, for giving your opening remarks. And Dr. Advani said very clearly that initially, when the COVID-19 pandemic was declared by the government, all the medical doctors or the professionals gone under hibernation because of the fear, because it was advised also by the government that one has to be very, very careful. But gradually, they realized that the COVID-19 is a pandemic, but what about the other patients, non-COVID, especially the oncology department or the cancer patients? And then they started treating them. But the problems which was there was first was infrastructure, because all the hospitals were full of COVID-19 patients, lack of nursing staff because they were also busy with the COVID-19 patients, and other problems like no transportation, any transportations to the cities, whether it's a bus or taxi or the flight or the train. So all those odds were there, but still they have started treating, and they found one thing very clearly, that in spite of COVID-19, all the patients who have received chemotherapy or the surgeries were done to them, they were all as they were pre-COVID era. So it means that although the COVID-19 is there, but the cancer patients are being treated properly by the doctors, the experts, as well as the hospitals, and they all were recovering as they were recovering earlier. So according to Dr. Advani, although COVID-19 is there, we have to take all the precautions which are required for the social distancing, etc. But one should not fear, and one should go to the hospital or to the experts to get the treatment without any fear, so that at least they should also be treated as the COVID-19 patients are treating. And according to Dr. Advani, the government has also realized, and that's why they released, instructed again that all the non-COVID patients should also be treated. And that's why now the situation is far better than the initial situation. Thank you, Dr. Advani, for giving your opening remarks. Now I would like to go to my next guest. He is also very, very senior doctor. He is Dr. Puneet Gupta. Dr. Puneet Gupta is MBBS, MD, DNB, DM. Dr. Gupta is the Director, Oncology Services, Metro Hospital and Cancer Institute, Delhi. Dr. Gupta did his MBBS from Snowden Hospital, Shimla in 1987, MD in Radiation Oncology from SCBMC, Cuttack, Odisha in 1994, DNB in Radiation Oncology from TMH, Mumbai in 1994, DM in Medical Oncology from Adyar Cancer Institute, Chennai, Tamil Nadu, India in 96. He has been extensively trained at MD Anderson Cancer Center, USA, Vienna University Hospital, Austria, SGH, Singapore. Before joining Metro Hospital, he was senior consultant and coordinator medical oncology at Apollo Indraprasth Hospital, Delhi. Dr. Gupta was instrumental in implementing first statewide community cancer screening program in India at state of Meghalaya with ROCO Cancer on an UK-based NGO and state government. He is the first in India to deliver the trans-arterial chemotherapy by continuous method using a special dedicated arterial electronic pump. Dr. Gupta used for the first time in India latest targeted drug therapy for head and neck cancer, T-cell malignancy, and AML. He is the first in India to harvest stem cells. He was the chief for India's first medical oncology DNB teaching program in the country. He is the pioneer in starting the India very first diploma in nursing oncology, diploma in psychology oncology at MIT University. He is a member of various national and international oncology bodies. He is medical scientific advisor to several organizations, including UK-based NGO ROCO, Cancer, etc. I will not name all, otherwise, again, the same thing what I have mentioned about Dr. Advani. To be very frank, for the first time, I faced a lot of problem to cut short the bio of these two doctors, because very, very difficult task for me, what to leave and what to take. Dr. Gupta presented latest original work at International Cancer Congress, Hong Kong in 2011 and published latest original work in March 2013. Sorry. He has done extensive community oncology work through ROCO Cancer in Meghalaya state, doing population screening for breast and cervix cancer covering whole state. He got several awards, including Times of India Award 2007, Business Sphere Award in January 2007, Arc of Excellence Award 2008, Indira Gandhi Shiromani Award 2006, prestigious Vijayashri Award 2005 for meritorious services, outstanding performance, and remarkable role in cancer care, etc., etc., etc. Welcome, Dr. Puneet Gupta, on our show. Dr. Gupta, you have heard what Dr. Advani has mentioned. Dr. Advani said initially, yes, all the cancer specialists, all the doctors rather, were gone in hibernation because of the COVID-19 pandemic. But afterwards, the medical fraternity realized that the COVID-19 is very serious, but other diseases are also serious. And then, according to Dr. Advani, they started the opening of the cancer treatment, especially, and the patients who have got the chemotherapy as well as the surgeries done, according to Dr. Advani, are as good as it was pre-COVID era. Although few of the patients got the COVID-19 infection, but they were also recovered. And Dr. Advani says that earlier the government was strict about the COVID-19, but now they have given relaxation and they allowed other non-COVID-19 patients to be treated. And because of the lack of infrastructure, lack of nursing staff, lack of medical fraternity, still the cancer patients have been treated. And according to Dr. Advani, the results are same as it was pre-COVID era. Now, we would like to know the COVID-19 impact on cancer patients. Dr. Puneet Gupta, please.
Thank you, Mr. Lal, for the kind words. And my best wishes to Dr. Advani and all the panelists. Dr. Advani has spoken the kind words and told the current scenario and the challenge. I call the COVID and cancer challenge as the double trouble, because we have to face the cancer challenge also, and at the same time we have to face the COVID problem also. And COVID is also a very smart disease, as we know, and the cancer is also a very smart disease. So basically, going beyond what Dr. Advani has told, I will use this platform to really educate the public about the biological aspect of the disease. We can just remember the mnemonic, I call it Dr. Puneet Brady Rascal. Why? Dr. Puneet DRP. Our human cells, they contain a signal which we call as DNA, RNA, and protein. So DRP, Dr. Puneet. Brady Rascal means there is a bradykinin storm. In now the COVID part, the cancer part signal happens in body when there is a problem in DNA, problem in RNA, and problem in the protein signal. Whereas in the COVID, it's a very smart RNA virus, and what it causes, Brady Rascal means it caused the bradykinin storm through activating what we call as a renal angiotensin system. So RAS is the renal angiotensin system. Now, what happens? We have to be very careful in understanding that DNA, RNA, and protein are affected by this RNA virus. It doesn't contain DNA, but it contains RNA, and it has the proteins. Now, to detect, for detection, we know that we can detect this virus by DNA testing, or by RNA testing, or by what we call as protein testing. In the DNA testing, the RNA of the virus is converted into the DNA by the machine artificially. So this is known as RT-PCR molecular method. Whereas there is another method of testing for the antigen, that are the proteins. We test antigen and also the antibody. So this is about the COVID story. And now about the cancer story, we know DNA, RNA, and protein. This signal, whenever there is a wrong in DNA, RNA, or protein, we get the cancer challenge. Now, there is a very important impact of all these two, because sometimes what happens, the COVID also targets the our immune system, and also the cancer also targets our immune system, and especially the patients of a subset of the patient who are undergoing bone marrow transplant, high dose chemotherapy, multiple myeloma, leukemias, lymphomas, and hematopoietic malignancies in general, and also the patients who are receiving the what we say high dose chemotherapy for solid cancers. These are the really what I say challenging patients who face the double trouble with a really a great warning. And we as practitioners, medical oncology practitioners, surgical oncology practitioner, radiation oncology practitioner, we face the music of dealing with these very critical patients. And here the challenge is really we have to weigh the patient appointments, and we have to see that how they travel through these times, how is their exposure in the IPDs, or how is their exposure in the OPDs. So I will say when this era started, we were caught unaware in around December of 2019. And by January of 2020, the things were getting cleared, and we know that there was a severe dip by March of 2020, as Dr. Advani has well said, that initially we were really kind of went into hibernation. So that is a very real scenario. So by March of 2020, everything was a dip. Many of the hospitals, they were, kind of temporarily closed, and many of the staff, they got infected, and many of the people were going on vacations. There were forced holidays, and there was, people were quarantined, nurses, doctors, medical staffs, even, initially very many cardiologists, because we were not knowing the disease process, how it is affecting, how it is causing the bradykinin storm, as I told you, how it is activating the RAS system, and all this molecularly, as we understand now very well, that this happens through a cascade and through a specific receptors. So what we call as ACE2, ACE2 receptors in the human body. So by this understanding, which was even we use supercomputers, very interestingly in this era, we mobilized all our digital resources. It was a big learning for us. And worldwide, you say the coronavirus solution has come through the supercomputer. The supercomputer told us that these RNA of the virus and also the proteins of the virus, they are acting towards the RAS system, and it is causing the bradykinin storm, and the receptors are ACE receptors. So this virus goes and attached into the ACE receptors, which are there in our nose, they are in our lungs, they are in our kidneys, they are around the blood vessels. So when these RAS receptors are activated in the blood vessels and there is an abnormal response, we get thrombosis. So this is how our patients were at the increased risk either of bleeding or they were going into thrombosis. So this is how the anticoagulation therapy was a very important finding. Then again, because this RAS system, RAS receptors, it causes inflammation in the human cell. And this is how they are pro-inflammatory response. We were using steroids were found to be helpful. So when we understood the biology that this is how the RNA and the proteins are affecting the DNA, RNA and protein of our system, the RAS system, the bradykinin system, the ACE receptors, and these ACE receptors are causing inflammation. And to subdue this inflammation, we are using steroids. And also we nowadays the trials are going on where we use ACE inhibitors. That is, let's say captopril and ramipril. These are the drugs where we use the ACE inhibitor. Also, we use angiotensin. As we know, behind angiotensin converting enzymes, we have renin angiotensin receptors also. So these angiotensin receptors, it acts through this ACE receptors also and angiotensin receptors also. So for this angiotensin receptors, we have the trials are ongoing where we use the drugs to take care of this uh, pathology, and we make sure that the inflammatory response are decreased by a drug which was used for cardiac heart failure, that is the losartan. So this is how the understanding of the molecular biology really in this COVID era, it was a challenge for all the doctors, nursing staff, and the what we say the pathologists, the molecular biologists. So we have to really understand the molecular biology of the pathology, what is all going around, and also for the let's say testing. We have to understand we are doing the antigen testing of the virus, antibody testing of the related to the virus, and also the messenger RNA testing of the virus. Then about the again understanding the vaccine which is going to come and which we are really eagerly waiting, because only one Sputnik 5 vaccine is now in the practice around the world, but we are eagerly awaiting very many vaccines now which are coming. And in the Indian scenario, we are having Zydus and ICMR. They are really the leaders, and we are quite hopeful that we are going to get this vaccine, but not in, I can say, 1 month, 2 months, or 3 months. It may take around 3 to 6 months, or maybe 12 months. So by this time, we have to be really smart enough to understand how we have to fight this out and what is the best protection for us. And here the cancer patients have to be really they have to save themselves from the what I call as the double trouble, COVID as well as from the cancer. And I think one point I will like to touch, Mr. Lal, if my time is over, you please let me know.
Just please be brief. You can speak for 1 or 2 minutes more. Yes.
So one last very important impact which I think I have changed in my practice is the home care. The home care scenario, we have to now include the home care people also in our team, because before pre-COVID era, we were not really, much tuned to the home care system. But now I think 80% of our care is delivered in the home care setting. So this is very important. Earlier, we used to have 80% of the care was hospital-based. 20% was home care based. Now it has reversed. 80% is now home care based and around 20% is now hospital based. In that too, the challenge is we must use the information technology. I will say the government and especially Modi ji was very kind enough to really fix in our mind the use of digital technology. So digital India, when the digital technology was offered to India, we doctors were not really using it so well. And I will say IT healthcare was not, up to the top what we could have. We have not realized its potential. But in the COVID era, I will say the one thing all the doctors, and we were really good enough, doctors have really learned it very well, and we have achieved it, that we have learned the IT healthcare has done magic. And because our system was very good, so we have a good software in the hospital, and we put the patient online. We have our oncology managers. They fix up the online meetings. We pre-register them. So when the patients have come to the OPD, now everybody, there's nothing like a walk-in facility now. The things have changed. It has become very organized. We pre-register our IPD appointments, our OPD appointments. We pre-register our visit. We pre-register X has to meet Y and Y have to meet Z. So there is kind of a clinical flow care pattern is there. So that, the point link between is not missing, because sometimes if doctor is sick, or nursing staff is sick, or technician is sick, or even your MRI lab is shut down, or your cardiologist is not there, or your medical oncologist is on leave. So all these logistics have to be set, because anybody can fall sick. In our hospital, we can say that anybody, we should be ready. Even sometimes surgical oncologist is sick, radiation oncologist is sick. So really these were the challenging times, and this is how we have to really gear up, and use IT really came to the rescue. Thank you very much.
Thank you, Dr. Gupta. And Dr. Gupta has given according to Dr. Gupta, it's a double trouble. He says, although Dr. Advani has given a very good talk about how the chemotherapy and the surgeries have been successful, but the trouble is that COVID-19 and the cancer both are creating double trouble and very much challenging for the patients as well as for the doctors. And he explained technically about the role of the cancer as well as the COVID-19, which and I am not a doctor, so I will not like to repeat those things which are very, very technical. But yes, he said that COVID-19 has taught us the IT sector, because we have now become very IT friendly. We are doing all the works on the IT platforms. And he says that earlier it was 80% of patients were treated in the hospital. Now it is reversed. 80% patients are treated at the house. And he says because of all these things, the treatment of the COVID-19 as well as the cancer is possible. He also mentioned that we all are waiting for the vaccine. Yes, the entire world is waiting. Although there is now there is some stay. Stay means not but the government has also stayed the vaccine which is under by the Serum Institute of India because of the Oxford thing. But what Dr. Gupta says that doctors, hospitals, nursing staff, and oncologists, everyone has learned the IT the technology and they are using it. And that's why there is no problem as far as the management of the patients are concerned. But only thing is one has to be very, very careful, especially the cancer patient should be very, very careful not to get any infection of COVID-19. Thank you, Dr. Gupta, for giving your technical things, which I am sure many of the patients and the doctors who are viewing our program will definitely be benefited by your views. Now I would like to go to next guest. Now my another two guests are young doctors but well qualified. I would like to invite my first guest. Now next guest is Dr. Najib B. Muhammad, MBBS, MD, DM. Dr. Muhammad is the Professor, Department of Oncology, Yenupaya Medical College, Mangalore. Dr. Muhammad has done his MBBS in 2005 from Yenupaya Medical College, MD from Yenupaya Medical College in 2012, and DM in Medical Oncology from BIMS and RC Bangalore in 2019. Welcome, Dr. Muhammad, on our show. Dr. Nazib, you have heard what Dr. Advani has mentioned and what Dr. Gupta has mentioned. I need not to re-summarize because you being a doctor, you know what they have mentioned. Now, we would like to know the COVID-19 impact on cancer patients. Dr. Nazib B. Muhammad, please.
Good morning, everybody. Good morning, sir. It was really nice listening to Dr. Advani and Dr. Puneet Gupta ji, who truly are an inspiration for all of us as a young medical oncologist. We look up forward to you, sir. And just for a correction, I am not a professor, sir. I am an assistant professor.
Okay.
So I would like to
I stand corrected for that. But we feel that whosoever is teaching is a professor. Yes.
Right. There is way to go, sir.
Okay. We wish you all the best for that. Yes.
Thank you. And so today we will be discussing about the impact of coronavirus on the patients with cancer. So basically what we are looking at is the patients as it is, they had the fear factor of this cancer. So we knew that whenever people hear the diagnosis, they used to look at, is it the dreaded C? So today we have true dreaded C's, the cancer and the COVID. So what are we looking at? So I would want to go a little different from what Advani sir and Gupta sir has said, and I would want to go into the ground reality that we are facing in places like where we are in Mangalore. So basically, as we all know, the coronavirus, SARS-CoV-2 virus, which began in December in Wuhan, is here to stay. And initially, as Advani sir said, that we all went into a hibernation in the beginning, and then we thought that this virus is here and we are going to stay with the virus and we have to adjust to the new normal. So when this new normal happened, in the beginning, it was a panic situation to most of the patients who are not accessible to get into the cancer therapy. So why cancer and COVID is important? What is the impact of cancer patients? Why aren't we looking at patients with other chronic diseases? So basically, when the COVID came and the mortality rate increased, so they said that it is the immunosuppressed patients who are at a very high risk of death. And so there were a couple of trials in Spain, Italy, and China, which showed that yes, there was a slight increased mortality and morbidity in patients who were with cancer. But there was a contradictory study in Australia which said that there was nothing of the sort, and all of them had the same incident. So, but when it comes to India, and why do we think that it is important? Is because not every patient is accessible to cancer therapy. The patients who are in a far off places have to come to a metro city or a second city where there is an access to chemotherapy or a cancer therapy, which was, I think, for about 2 to 3 months, which the patients couldn't come because of the initial lockdown phases and due to this COVID. So the reason being, we will not be not everybody is trained to give treatment for chemotherapy, and not all the staffs and all the nurses are trained to give chemotherapy. So that is the reason why the patient need to travel to a cancer center or a tertiary care center to receive chemotherapy, and which most of the time the tertiary care centers, most of the time tertiary care centers were converted into a COVID hospitals, and probably at that time there was a delay in giving chemotherapy or accessing to the diagnosis. So the impact of this would be that at the time the patients wouldn't be able to come, so they would have either might have progressed or may progress if they have not received definitive therapy on time. And the other way of looking at it is also the delay in diagnosis. The patient probably who were maybe in a curative stage would have gone to a metastatic stage, and more of a palliative intent of therapy is what we would be looking at because of this delay in the diagnosis. So this is one of the most important thing which most of our patients do say that they have suffered because of this pandemic. And coming to the mortality and morbidity, what we have seen is the incidence is almost on par with all the non-cancer patient, was on par with on the population. But what we have noticed is when these patients went into a cytokine storm, the patient had the response of the patients with COVID, with cancer to COVID was not that good. So the mortality, what we have seen here is slightly more compared to the non-cancerous patients when they went into a cytokine storm, when the oxygen saturation was on the lower side, when many of them requiring mechanical ventilation, and unfortunately some of them wouldn't who have succumbed to that illness. So now that things with unlocking 4, the patients are coming, the things have already started. So we are now going fully into the treatment. There is no point in just giving metronomics for palliative patients, which we used to do during the time of lockdown, when the patients could not come or they never had an access to intravenous chemotherapy. So by telecommunication or telemedicine, we used to put them on metronomics and hope that they don't progress. So now, since things are coming back to normal, that fear of COVID is slowly going away from the patients, and we are also more confident in treating the patients with the way we used to treat pre-COVID era. So and the responses have been equally good. There has not been any unexpected incidents that have happened with the patients during this time after the COVID, after the unlocking that has started, and the patients have not succumbed to any of our treatment, and there was no abnormal unexpected event that has happened. So we are looking forward to getting it back to the full oncological perspective, going completely into in depth of managing the patients. irrespective of COVID or non-COVID, but with due precautions to the healthcare workers, with due precautions to the patients and to everybody involved, which is as the WHO has recommended for what is required for the COVID safety measures have been followed.
Hey, thank you. Thank you, Dr. Nazib, for giving your views. And according to Dr. Nazib, initial the reports from the Spain, Italy, and China said that those who have cancer, they are more prone, mortality rate is more. But in Australia, when the research was done, they found that whether cancer COVID patient or non-cancer patient COVID, they had the same mortality. And he says in India, initially, yes, the mortality was a little bit more because the patients were not getting the treatment which they were supposed to get, the chemotherapy and all the surgeries, etc., because of the lockdown. And he says it was very difficult for the patient to travel to the metro or tier 2 cities because of the lockdown. But the other centers which were providing chemotherapy, the small hospitals or the chemotherapy centers, they were closed down because of the they were converted in the COVID-19 to treat the COVID-19 patients. But now after the lockdown 4, the patients have started coming, and he says now all the patients have been treated as it was treated earlier, and they are giving the full response to the treatment and no mortality as such as because of the COVID-19. So according to Dr. Nazib, although COVID-19 has impacted very badly initially because of the lockdown, but now because the patients are coming and the treatment is giving and everyone is giving the treatment, all the doctors and everyone. So there is no as such the problem is. Initially, yes. So thank you, Dr. Nazib, for giving your views about the COVID-19. Now I would like to go to my next guest. She is Dr. Anisha Babu, MBBS, MD, DNB. She is the consultant oncologist, NSMIMS column. She conducted an observational study of inflammatory markers in cancer of uterine cervix. She is also part-time consultant in ESI Super Specialty Hospital, Ashar Mam column. Before joining NSMIMS, she was the consultant in the Department of Clinical Oncology in SUT Hospital, Patam, from November 2018 to April 2019. She did MBBS from TD Medical College, Allapulja in 2012. She did her MD in Radiation Oncology from Regional Cancer Center, Trivandrum in 2018, DNB in Radiation Oncology in 2018. Till now, she published 3 research papers. Welcome, Dr. Anisha Babu, to our show. You have already heard what Dr. Advani, Dr. Gupta, and Dr. Nazib has mentioned. I need not to repeat because all are very candid and technical. I want you to tell us the COVID-19 impact on cancer patients. Dr. Anisha Babu, please.
Thank you for the kind introduction. Very good morning to my co-panelists. I'm very blessed to share this panel with great doctors, great oncologists whom we always look upon. And I think most of the details have been shared now by Advani sir, Puneet sir, and Dr. Najib. We all know that this global pandemic, COVID-19, has been, it has affected all the aspects of life, especially healthcare. In all the, why this onco patients are at a increased risk of this COVID-19, there was various studies have been conducted. And recently, there is a publication in Lancet, which is a clinical impact of COVID-19 on cancer patients. It put forward that the mortality rate is increased in cancer patients due to COVID-19. Especially, there is significant association between some factors like age, more than 60 years, more than presence of more than two comorbidities. We all know cancer patients, usually age is a very important risk factor. So they will have many comorbidities. Most of them will have habits like they will be smokers. So smoking has, we all know, it has increased risk of reactions in the due to the production of angiotensin converting enzyme. So they will this COVID SARS virus has increased risk of acute lung injury in some such patients. Then male sex has an increased propensity of morbidity related to COVID. Then active disease like hematological malignancies, and also the most of the cancer patients will be in an immunosuppressive state because of the high dose chemotherapy, targeted therapy, and other immunosuppressive agents like steroids. And because of all these factors, they are in high risk community. As Advanisa has said, initially we all went into a phase of hibernation because this disease is actually a newborn baby. We don't know how what was the impact on all aspects of healthcare. So we went for a hibernation phase. So during that time, there were reduction in the screening programs, there were reduction in the cancer trials which were conducting due to the financial burden which was affecting the whole nation or whole world. And there were a reduction in the surgeries were postponed. There were endoscopic procedures because of the aerosol generation. Everything was postponed. Because of that, the detection of cancer, everything was postponed, and this increased the death rate as well as the delay in active treatment. But later we realized this is not the way to deal this disease, because it will be this COVID-19, it will be a global pandemic, it will be with us. We have to act, we have to move on. So what we started practicing many because we cannot deny the standard cancer care for the patients irrespective of whether we are going for a radical intent, whether we are going for a palliative intent, or what modality of treatment we are opting. We have to proceed with the treatment. So what they did, what we practice in Kerala, I'm an oncologist from Kerala. What we here practiced was, we just because we all know cancer patients, they will have to come to the healthcare frequently. So there will be a increased hospital visits. They will require frequent supportive care, and that most of the patients will be increased hospital visits will be there. So that was we started telemedicine system in our hospital. So it was actually very effective. And then in OP patients who are not much sick were treated with telemedicine system. Then chemotherapy scheduled also, we just weekly schedule was transferred to 3 weekly schedule, because so that they can be the hospital visits can be reduced. And in case of radiation, we opted for a hypofractionated schedule. That is, we can give number of radiation fractions will be reduced. The dose delivered will be increased. So for cancers like prostate, breast, etc., we can adapt that schedule. A lot of measures where doctors have taken, and other health workers also. So because of all these situations, we could manage or tackle the situation to an extent. It is not actually only time can tell how will be the effect, but still in this scenario, we are without compromising patient care, we are actually trying to give these type of modifications in the cancer care without compromising the efficiency. I think government as well as the public is still also aware of the situations. Now they are taking personal protective measures, like all the which we all know, and doctors are taking personal protective measures. But we have now, I think we have decided to live with the disease concept, and to provide the maximum efficient healthcare based on that. That's what I think.
Okay, thank you, Dr. Anisha, for giving your views. And according to Dr. Anisha, yes, initially it was a very difficult time. All the medical people were under hibernation, especially those who are not in COVID-19 treatments. But she says that then they realize that they have to come out and they have to treat the patient. According to Dr. Anisha, that study says that those who have suffering from cancer, they are more, their mortality rate is more. which she has quoted the Lancet recent publication. Now, but she said what we have done in Kerala, according to Dr. Anisha, that instead of calling everyone, all those patients who require weekly chemotherapy, they increase the dose of the medicine and then make it for thrice once in 3 weeks. So the number of the visits to the hospital reduced, especially for the prostate and the breast cancers. And she says by this way we tried our best so that the patients can not suffer. They should not get infected by the COVID-19 because of their frequent visits. And according to Dr. Anisha, now because of the lockdown 4, they are trying their best to give all the treatments whatsoever is possible with the modifications to the patients, so the patient should not suffer. Thank you, Dr. Anisha, for giving your views. Now I would like to ask Dr. Advani. I think he's busy in the phone. If once, okay, now I will go to Dr. Gupta. Dr. Gupta, I will ask you because Dr. Advani is right now on the phone, so I can ask you the question. The question is, how have cancer patients regained confidence to visit hospitals again for treatment? Because what happened due to the COVID-19, there is a fear factor among the patients because of the reports came in media that everyone who is having any element of disease is prone to COVID-19. And when the patients, when it was also mentioned that the all the top or the main hospitals have COVID-19 patients. Now at that juncture, to come to for your treatment of chemotherapy or to visit or for consultation, that the patients were not ready to come, although they were suffering from the cancer. Now, do you think now cancer patients regain confidence to visit hospitals again for treatment? Dr. Gupta, please.
Yeah, thank you, Mr. Lal. I'll say that as Dr. Babu has very rightly highlighted that initially, there was a serious concern whether COVID and cancer, once they go hand in hand, and they are going to severely affect each other. And, it was a serious finding also that if you see a COVID patient without cancer, they after the onset of the symptom, let's say if there is a breathlessness, so majority of the patient, if you study who were going on the ventilator, they were going on the ventilator on day 8, 9, 10, 11, 12 or day 13 or day 14. So it was a kind of a delay, initialization on ventilator. But if some cancer patient is there and they catch the COVID, they will be on the ventilator, if the onset of breathlessness and the day 1 of the ventilator, it is a very short time. So within 8 days, you will find these cancer patients are on the ventilator. So the worsening, maybe, it was a bit quicker than a person of a COVID person without cancer was really, there kind of was a more safety margin was there. So even if you kind of delay the diagnosis, delay the onset of breathlessness, don't catch them young, and to find the let's say lung involvement, because as I told you, bradykinin flare, it give rise to the hyaluronic acid. This hyaluronic acid, it now accumulates in the lungs and it forms a layer, and that causes the choking of the lungs. And even at that time, the most important thing is very important is the early oxygenation. So early oxygenation, whether you use a nasal prong, you use a BiPAP, you use even the ventilator is put. So very, very important was that the early oxygenation, and also in the cancer patient, the time has squeezed to worsen. So here, the government did a very good thing, that early lockdown was really a kind of boon to us in India. And very many countries, and I will say very many democratic countries, even they delayed their lockdown decision. And what this early lockdown in India, it gave us a double advantage. What it does, it gave the public the time to get aware of the, let's say, protection. They knew how to use masks, how to use the goggles, how to use the face shields, how to use the hand washing, how to use the precautions not to touch the nose or not to touch the what you say, the face repeatedly, and how to really diagnose themselves that it is not the fever alone, and it sometimes it can be the loss of smell, loss of taste, even it can be cough or fever, or even without fever or cough you can simply present with loose motions, or you can present with cardiac problems, or even you can present with the brain problems, that you are in altered sensorium. So all these kind of variations, with or without fever, the public was educated during this lockdown. And second thing we did in this lockdown, the government did early lockdown was a boon. In the another way, another side of the coin was also favorable, that we had a time to do what we call as a capacity building. The capacity building was done. We were able to change some of the nursing homes into the COVID hospitals, and some of the hospitals which were already having COVID facility into more beds, and some of the beds were more beds were added, and in fact we started having dedicated COVID hospitals. Government made it a 1000 dedicated COVID hospital in a state A, state B, like that. So they really started what we call capacity building, facilities building, the dedicated facilities for the COVID. So that was a very good thing. So initially there was a dip in, even if you see in US, you see in Europe, there was a serious, almost 100% of the hospitals were hit by, either 10% of them were closed in US, if you see temporary or permanent, 30 or 40% they have to lay off their healthcare staff, and about you can say 40 to 50% of them had severe financial problems. So even if you see, their ventilator ratio was very good. US has 35 ventilators per lakh of the population. India has only 2 or 3 ventilators per lakh of the population. But our public awareness and our capacity building, really we caught with them. So that was really a boon. So most important decision I think the government has done good to India was that early lockdown, or what Dr. Advani tell us as the early hibernation. So this early hibernation was really a boon. And this really paved the way for our comeback. So this early capacity building, early hibernation, and early public awareness. And now we very well know, we change now. It is very important to understand now the pandemic is going to change into what we call as endemic. Now, instead of, it may go in a pandemic fashion, we may be happy, okay, that country is gone, that is not having anything, or B country is not having anything, but what will happen, it will remain in pockets. So now it will become endemic. So now the government has a very good facility here. We are tackling the disease as, let's say, green zone, yellow zone, and red zone. And also we are, when we see the patient, we say level 1 patient, level 2 patient, level 3 patient. And as far as therapeutic guidelines are concerned, we have what we say the treatment categories. We say type 1 category, type 2 therapy, and type 3 therapy. We know in the type 3 therapy, which is very aggressive, we do markers like, say, let's say lymphocytic depletion. If we find that LDH is high and the other markers of inflammation, ESR is high and LDH is high, interleukin 2 is high, and then we find if the type 3 category patient lies in the type 3 category, treatment is different. For type 2, treatment is different. For type 1, treatment is different. Similarly, so this is how we have to really tackle the problem. And the comeback, then now we are finding that there is a comeback and it is in a good way. And we know we have to follow all these instructions. Public is ready and facilities are ready. Thank you.
Okay. Thank you, Dr. Gupta. According to Dr. Gupta, the early lockdown is a boon for the country because the medical facility was ready and capacity building was done. Although, Dr. Gupta, we have seen reports in media how the migrants suffered. That is another thing. But anyways, but it is good. At least the medical fraternity or the medical hospital capacity was built. Now I would like to go to Dr. Advani. Dr. Advani, you are busy in the phone. That's why I took Dr. Gupta first. My question to you is, since news of after effects of COVID is coming, do you expect any increase in lung cancers, etc.? because of the after effects of the COVID.
Yeah, that's right. I think just now, what is the experience all over the world is with the acute problem of the coronavirus. We know what happens now, as Dr. Puneet Gupta has clearly mentioned, how there's a storm, cytokine storm in the body, and every organ can be affected. What will happen in future is yet to be really noticed, because there can be many chronic damage to the various organs. I mean, we know that influenza, one of the factor for the interstitial fibrosis is uh, inter, the influenza pneumonia that can cause the interstitial fibrosis of the lung. So similarly, there will be many more problems which we may face, both those who are young or elderly who have cured of the coronavirus now can face the problem. Now, what will happen in terms of whether they will develop cancer? I'm not sure. I don't think it will produce the cancer, because that's not the way the RNA virus will do any damage to the cells. So personally, I feel that it will cause lot of maybe heart problem in terms of function, lung problem, pancreas problem, maybe diabetes, those who develop the pancreatitis, but not the cancer. I don't expect that people who have suffered from coronavirus will live to see in cancer.
Okay, thank you, Dr. Advani. And Dr. Advani clearly mentioned that yes, coronavirus is going to affect the after effects of the coronavirus will be on the organs. Different organs might be on lungs or the heart or the pancreas. It may create some problems, but he is very clear that according to Dr. Advani, the cancer that we say that it will be lung cancer or other cancers will increase because of the after effects of coronavirus. Dr. Advani is not of that opinion. He says, no, it is not very unlikely that it is going to happen. But yes, it may affect the organs. The diabetes can increase, the heart problems can come, and lungs problem will be there. But to say that increase of the lung cancer, according to Dr. Advani, it is not likely. Thank you, Dr. Advani, for giving your expert advice. I'm sure the viewers are very relieved by this view, because everybody is afraid about the cancer, and if that is not there, then at least one thing is ruled out. And now I would like to go to Dr. Nazeeb. Dr. Nazeeb, since treatments are delayed in COVID, has it worsened the cancer patient's care? Because initially, due to the lockdown, no chemotherapy, no proper consultation, even the teleconsultation started very late. Initially, the doctors were not geared up for the teleconsultation. So those patients who were already under stage 3 or stage 4, were their conditions worsened due to this, because of the lack of patient care in time? Dr. Najib, please.
It is definitely, it is possible that the patient would have progressed if they have not taken any form of treatment for the last 3 to 6 months, if at all they haven't taken any form of treatment at all. But since the telecommunication and the telemedicine has come up, and we doing the video conferencing and the normal calls, so we would be able to give them some sort of metronomic therapies to control the disease. But if you are asking about the long term, the data is still yet to come. But if you are asking whether they would have progressed, there are chances that if nothing has been done, they would have progressed if they were already metastatic. And some of the patients who the surgery would not have been waited may end up being in an inoperable stage. But we still are far from knowing exactly what it is.
Okay, thank you, Dr. Nazeeb. And he says that the data are not available, that what effect has come. But yes, definitely the delay was there. But doctors have started giving them the teleconsultation immediately and try to give them diagnose of the 9 medicines, so that at least they will not suffer. And but the data are not clear. So once the data will come, definitely they will come to know. Now I would like to ask Dr. Anisha Babu, please. Dr. Anisha, this smaller cities and villages got their chemotherapy radiation during, because the patients were not getting the chemotherapy, and the metro, the Bombay or Delhi or Bangalore or Calcutta, Chennai, they have the facilities. At least the patients can go or talk to the doctors on telecommunication, teleconsultation. But a small city or a small village, what happened to those patients during this lockdown period?
I think cancer centers are there in the case of Kerala. There are that is in government setups. There are chemotherapy is being administered. Radiation facilities usually in higher cancer centers like regional cancer center and other private hospitals, government medical colleges and all. But actually, it is the patients for undergoing treatment usually take treatment from either cancer centers, or they will carry out chemotherapy from district hospitals which are nearby. But the issue is, irrespective of the small villages or towns, this due to this COVID pandemic, due to this fear, patients are reluctant to treatment. Especially for an example, I have come across many patients who have delayed their adjuvant treatment, that is the treatment chemotherapy after surgery, for many months. It's actually in this scenario we cannot because they were very much frightened that if they come to a very high volume cancer centers, they will get infected because a lot of people will be there, and usually it is very difficult to control the infections in high volume centers. So the problem was they were simply sitting idle in home for almost 3 to 4 months, and due to this, the treatment will be prolonged. So we know we cannot treat all patients like radiations, everything. We cannot treat all of a sudden. It will take time for radiation planning and everything. So their treatment will be delayed. So it will have a time for a microscopic metastasis. That is adjuvant treatment. If it is delayed, there will be sometimes they will present to us in a stage 4, because that, so we have to change the intent from radical to palliative. Many in my experience, I have come across many patients, but this actually we have started because now it is gearing up. We are coming to the track now. So there was a situation, there was a period in which doctors also couldn't act, because we were restricting OP at that time during lockdown. Only emergency cases were attended. So at that time, all these adjuvant treatment, all the diagnosis delay, they will be coming with the pathology report for after 2 months. At that time, initially the stage may have progressed. So that is happening even in small villages as well as in big towns. The situation, I think, it's similar, but because but something there's something which we couldn't because during the lockdown period we cannot act much during that period, but now it is being compensated. That's what is happening.
Okay, thank you, Dr. Amisha. And what she says that yes, initially there was lots of problem, but still the villages or the small cities, they have the government facilities, especially in Kerala, where they were giving the chemotherapy. For radiation, they have to come to the district hospital. But although these are the views of Dr. Amisha, but what my report says that even the district hospital, which have been converted in COVID hospitals, it was very difficult at that time to give the chemotherapy to the cancer patients. And as Dr. Nazim and Dr. Gupta has mentioned, that the patients were reluctant to come out because of the fear of the cancer, of the COVID. Now, I would like to ask, not ask, rather, I will take his opinion. Dr. Advani, what are your suggestions to the government and advice to public, keeping COVID-19 in view? What you feel, because after you have seen how the government has handled and how the patients have reacted, keeping in view all these, what are your suggestions for the future now? Whatsoever has happened, but now what you think, what should the government should do, and what should the public should do so that they can survive easily?
I think I must admit that in spite of all the limitation of India, the government has done very well in terms of very sincere effort to see that COVID-16 COVID-19 comes under control. Although in spite of that, you have seen the numbers are increasing and the need of the treatment is increasing. However, they have really allowed the proliferation of the centers who are specifically for the COVID-19 patient. And I think that's one of the best things that they have done. Even in hospitals, which are treating both COVID-19 and non-COVID patients, they have segregated in the hospital so that what is important in the hospital important is to treat the patient who comes, but at the same time don't allow the patient who has come to suffer in the hospital from other disease. And I think that is where people have become very conscious. Hospital administrators are conscious, the hospital medical facilities, they are conscious about that. And that is what has really allowed us now to really motivate all of us as well as the people to have a confidence that they can get the same treatment as before in COVID-19 before, and at the same time, they are also protected from the COVID-19 virus. So you have to assure them that you are protected. We are taking every care to protect your interest from COVID-19, and we'll give you the treatment for the cancer as well. So I think with these assurance, I think people will have the confidence. Just now, still maybe in some hospitals, that sort of a care is not there. And I'm sure there are people who are fearful. They have a fear that if they go out, they have a fear that if they walk in the garden, they can catch the infection. So those are things which will slowly go off. But hospitals, particularly all the hospitals in the major cities, have taken these precautions. And I must compliment the government who has got nowadays dedicated centers for COVID-19. And I think they are doing a very good work as well. So I think this sort of a separation will allow healthcare workers to also work efficiently as well as the patients to take the treatment very confidently.
Thank you, Dr. Advani, for complimenting the government. According to Dr. Advani, the government of India is doing very good, and they are taking lots of good measures for giving the best treatments to the patients. And he says that even the separation of the COVID-19 and the non-COVID-19, now the position is that whosoever is coming for the treatment, they are getting full treatment. And Dr. Advani assured that almost all the hospitals in India, they are giving the best of the treatment, that they are treating especially the cancer treatments are as the pre-COVID, and one should not have the fear that they should not come and they should not take the treatment. According to Advani, if anybody is suffering from cancer, they must come out and take their treatment continuously. Don't break the treatment. Very good advice from Dr. Advani to the public at large, and especially those patients who are suffering from cancer. Please do come and take that. You go to the hospitals wherever you are registered, get your chemotherapy or other treatments. Otherwise, it may be worse, so it is better. And according to Dr. Advani, if you are taking precautions, you will not get COVID-19, and the hospitals are taking full precautions and taking all the hygiene conditions so that patients will not be affected. Thank you, Dr. Advani, for very kind words as well as a very meaningful message to the public at large. Now, I would like to ask the same thing to Dr. Gupta. Any suggestions to the government and advice to public? Dr. Gupta, please. Please unmute. Please unmute, Dr.
Unmute.
Gupta. Please unmute. Yes.
Yeah, Mr. Lal, one major concern of mine and request towards the government is that the death rate in healthcare workers. If you see, there was a study from JAMA about 85,000 non-doctors and about 2,000 doctors were studied in that sample. And you know that the death rate was very, very, very low in non-doctors. It was 0.3% because majority of the time doctors they aloof the doctors and they just use the term healthcare workers, maybe doctors, nurses, sweepers, or like that. Because they have to realize that the doctors comes at very close contact with the patient, and especially in ICU setting, the major concern is with the doctors. And number two, also in the critical care setting, and especially in the COVID wards, dedicated COVID wards, doctors are in very close contact. Any exposure more than 10 hours, invariably in the international studies have shown that the incidence of serious infection is high. So death rate in Indian doctors was around in tune of 15% in this sample of 2000 patients. And what is very, very alarming is that this high death rate will deplete us of our, doctors especially, because in non-doctors the death rate is very, very low. So we cannot mix the two populations. Here I request to the government that please be serious in providing PPE to all the COVID hospital doctors, and wherever you are telling convert one nursing home into a COVID sector, but you must assure that all the, if there are, let's say 20 beds, 30 beds, 60 beds, and let's say some 10 doctors are taking care, so in 1 month three same amount of personal protection equipment, PPEs. And also when the vaccination will come, the first in India, the person who should be getting the vaccination should be the healthcare doctors, not I am telling healthcare workers. Here we should be very precise, and government should understand and make a clear cut practice, and do not confuse healthcare workers with just the, I will say, non doctors. Here I am telling only the vaccination and PPE kit should compulsory be given, and first of all should be given to our healthcare doctors, COVID doctors, and because the death rate is very high, 13%.
Okay. Thank you, Dr. Gupta. And Dr. Gupta says that the doctor's rate of mortality is very high in India, about 15%. And he says that once the vaccine is come to India, it should be given first to the doctors. Although I think the vaccine first will go to the politicians, then the bureaucrats, then the corporate houses, and then the chances of the doctors will be there. Anyway, now I would like to ask the same thing to Dr. Najib. Your suggestions to the government, if any, and advice to public.
I think I agree completely with Dr. Gupta sir when sir said that the doctors must be given the first line preference. And the coronavirus 19 has taught us a lot of lessons in life, that the basic necessities of life, and also taught a lot of hygiene to the normal public. So I wish that this continues even the post-COVID era, and it just doesn't stop with this being in this pandemic only. And I hope the public understand the importance of these things, and they do carry on forward even after the post-pandemic. And to the government, definitely, what they have done a good job, and we would request them to, as Dr. Gupta said, that most of the doctors and most of the hospitals do get a very good PPE, which is at least the basics that the government can provide to the healthcare workers. So, okay. Thank you.
Thank you, Dr. Najib, for giving your suggestion and advice. Dr. Anisha, please. Please unmute. Please unmute. Please unmute. No, it's not unmuted. Yeah.
Okay. I think all my seniors have mentioned it clearly, because I think doctors are mainly the forefront warriors in this contest. So they should be given almost, because if the doctor get affected, lots of patients will suffer. That we must always keep in mind. And the next thing I have to say is there are a lot of emotional as well as psychological issues going on among healthcare workers, because they have been carrying duty for almost a long duration of time. So that aspects also should be looked into, and also the personal protective measures, because the public also has to take part in that, because they must not, even though if they have a suspicion of infection, they must not spread to other. That should be that they should ensure. and they should also take all these protective measures. Amidst all these chaos, what we have noticed that there is a lot of reduction in other respiratory tract infections. Lots of health issues have been reduced, like in pediatric population, because of these precautionary measures we are taking, like hand washing, using face mask, social
Okay.
distancing.
Okay.
Everything is important. That is some positive aspects.
Okay. Okay. Thank you, Dr. Anisha, for giving your suggestions that the doctors should be given full protection. So today you have seen the top cancer specialists, the doctors have given their views, and they have said very clearly, although COVID-19 has affected initially, but now it is not there, and they should not, the patients or those who have any suspicion about the cancer, they should not feel any fear to go to that expert doctors, show to them, and if they are already a patient of cancer, they must continue their treatment without any delay. They can go to any hospital or the expert doctors, because there is no chances of infection, and according to all our doctors, they are taking full care. One thing which they have mentioned is the doctor should be respected and giving full support from the government. Only by beating the thalis or showering the flowers will not do the work. We must praise them in from our own side, and we government should also give, and the civil society should also come forward to give what doctors are giving to us. They are giving us the new life. Our responsibility as a civil society is to respect them and to see to it that doctors will get whatsoever they require from the government or from the society. Thank you very much for watching our shows. And today's show has been live telecasted by V4 News, V4 Stream, Global TV, Malnadu TV, News Gaon Se, Samvad Sarokar News, as well as it was shown live on Facebook and YouTube. And our endeavor is to bring every day something new topic. But tomorrow we are going away from this, because the doctors have advised that the immunity is the main factor to fight COVID-19, and immunity have to be strong. And for that, you should be happy. And for the first time in last 5 or 6 months, we are breaking our tradition. And tomorrow we are giving the media conference with Lal Goel, with Mr. Ravi Sharma, renowned online singer, with a program of Bhule Bisre Geet and Ghazals. Mr. Ravi Sharma is going to sing from KL Sehgal to Pankaj Malik, Sri Chatma, Jagjit Singh, Pankaj Udas, all the top hit songs you will hear, so that you will come out from the depression and increase your immunity. Thank you very much, Dr. Advani. Thank you, Dr. Gupta. Thank you, Dr. Nazeeb. And thank you, Dr. Babu, for joining us and giving your expert opinion. Thank you very much. Thanks a lot.